So let's go ahead and introduce Dr. Wade Nishimoto. He is a board-certified medical oncologist. He specializes in hematology, and he's been in private practice at California Hematology Oncology Medical Group for over 25 years. After completing his undergraduate studies at the University of Washington in Seattle, he finished his internship, residency, and fellowship in oncology and hematology at the University of California, Irvine Medical Center. And he joined the California Hematology Oncology Medical Group shortly thereafter. He practices mainly out of the Torrance office, which is like 3 buildings over, I think, from here. He is originally from sunny Hawaii, and Dr. Nishimoto transplanted to Southern California in 1984. And he brings his own version of the aloha spirit to his practice of oncology. He's a fitness enthusiast and enjoys tennis and travel when he has the time. So please help me welcome Dr. Nishimoto.
I'd like to thank the Survivorship Consortium, Nancy, Miriam, for inviting me here. Actually, they had to kind of beg me to come here because nobody else wanted to do it, right? No. Anyway. But it's my job tonight to kind of introduce integrative medicine from an oncology perspective. This is something that is becoming more and more visible. I think people are afraid to talk to their doctors about using some of these adjunctive therapies, but the truth is that more than 60% of cancer patients actually have some type of integrative medical thing on the side that they want to use, whether it be food as medicine or acupuncture, yoga, meditation, visual or guided imagery, and a variety of different things that I'll just briefly touch on. I can't possibly go into everything in detail. That would be a week's session, and I've been given about 20 minutes to talk, so here we go. Well, just as a perspective, California is in the top 10 states with the lowest incidence of cancer per population. You might think that that's something wrong because we have so many cancer patients. It's just that we have so many people that live in particularly in Southern California. And what's nice to know is that the death rate of cancer has decreased 23% from 1991 through 2012. And this is due to a variety of different things, including earlier detection, and that's because people know more about their disease and are not afraid to talk to doctors or even their families about something that's going on with them. It's due to preventive measures, including decreased tobacco use, viral vaccines, the use of sunscreen, and also and this is where I come in, to improve treatments that are available, that are better tolerated, that are more effective, and people just are living longer, which means that there are more survivors, and that's what everybody's here for, it's their survivorship. And so more and more, a lot of these integrative approaches help with coping with all the therapy that they've been through and making their life better. This is just a quick overview you can see of the rate of cancer death in the United States. And as a general rule, this is in males by sight. You can see it going down since about 1990 or so. The curves are on their way down, and this is good. People are living longer. This is for women, real quick. So integrative medicine is just the use of complementary or adjunctive therapies. And like I said, more than 60% of patients with cancer, they utilize something that's apart from standard therapy. And this includes, dietary adjustment, using food as medicine. And to plug something else here, the Grazia Dio family sponsor a food as medicine series, and this is something that is on the website at Torrance Memorial and something you all, I'm sure, are familiar with, but it is available, and that they just deal with nutrition. We have, use of nutritional supplements, herbal therapies, exercise and yoga, as we're going to experience a little later, acupuncture, bodywork therapies, including Bowen, Reiki, massage therapies, and mind-body therapies, including meditation, guided imagery, and mindfulness. So what isn't, complementary therapy is what it isn't. There's no formalized research that has shown that complementary therapies can cure cancer. Okay, so that just from the beginning, I'm just going to say we don't have any studies that show that these complementary therapies cure cancer, but they may help in your treatment. There is indirect evidence that these therapies may reduce recurrence or prevent malignancy through a variety of different ways. Okay. Just touching really briefly, and you're going to hear from a dietitian who'll know more than I do, but food as medicine, there's a lot of talk about vitamin therapy, antioxidants, and eating foods rich in nutrients is superior to individual vitamin supplements. And I think if you've been going to these Grazia Dio Food as Medicine lectures, you'll know that, that Dr. Neil Bernard, who was able to speak at one of these talks, I think it was within the last couple of years, actually, he demonstrated that, it's not so much taking vitamins, but it's the ratio in which you take the vitamins, and that's what's in your natural foods that is actually important. So eating, and he comes from a vegan standpoint, and so, this ratio of the vitamins is more important than just taking vitamins for the hell of it. It's the combination of these nutrients that is likely the key in maybe supporting everything. Now, I'm going to be very honest and say I'm not a vegan. I'm not a vegetarian. I'm a little more lax. I like to eat. I'm from Hawaii. So we like to eat anything and everything. But, a diet more rich in plant-based nutrition is much healthier. And you can have a little bit of the other stuff. There's some talk that vitamin D3 acts as a deterrent to cancer, and there is some data to suggest in the literature that vitamin D deficiency, which is rampant, it's an epidemic in the United States because people don't want to go out in the sun, and vitamin D is actually not a vitamin per se. It's a fat-soluble hormone precursor produced in the skin when you are exposed to sunlight. Nobody wants to go in the sunlight because they're worried about skin cancer or aging and wrinkling. And so it's particularly here in Southern California, we have a lot of that. And they think that deficiencies may predispose towards certain cancers like breast cancer in women, prostate cancer in men, and colon cancer in both men and women. And so they're actually trying to use, in some clinical trials, vitamin D as part of their chemo regimen. I'll just say that the usual supplemental dose is somewhere between 2,000 and 5,000 international units a day, and most people take somewhere in between that, and some people actually need more, and I have some patients that are on 50,000 units, international units a week. And antioxidant therapy may help prevent certain cancers, but I push the food as opposed to taking vitamins. The actual only vitamins that people should take are vitamin D3, because we can't get that otherwise. They think that it's sometimes available in mushrooms, but eating too many mushrooms can be toxic because all mushrooms have some degree of toxin in them. The other vitamin that I advocate taking is B12 if you're a vegetarian or vegan, because that's mainly found in animal protein. We often caution our patients about taking antioxidant vitamins when they're on either radiation or chemotherapy, because it does help protect the cells and makes their therapy not as effective. There are immune boosters that people like to take. Everybody cites the mushrooms, reishi, maitake, shiitake, but again, I'm going to just warn you that mushrooms have inherent toxicities if you ingest it in high quantities, but I love mushrooms. Soy, one of the few foods that contain all amino acids required for making protein. It's high in calcium, iron, fiber, omega-3s, omega-6s. It's also high in phytoestrogen. So we always caution people that have breast cancer that is estrogen receptor positive about that. Soy has anti-inflammatory properties and, like I said, caution for use in estrogen receptor positive breast cancer. Although there's some studies that show that it may not be harmful. Sugar, everybody talks about sugar as a bad thing, but you need sugar in your body to run cellular function. And so it's just a matter of how you take the sugar. And so high fructose corn syrup is particularly bad, and as this must be broken down to glucose by the liver. And overabundance can lead to liver fat, fatty liver, steatosis, which in turn predisposes towards obesity and the hypermetabolic syndrome. And as you know, obesity is associated with a higher incidence of certain types of cancers like breast, colon, prostate. I mentioned briefly about turmeric and curcumin because everybody talks about that. And there is evidence it may suppress tumor cell proliferation in some studies, and it has anti-inflammatory effects. There's ongoing studies in combination with chemotherapy for prostate cancer. Still haven't heard the word yet on how effective it is, but we use it over the counter. I know a lot of people use turmeric, but in the medical field we use it as curcumin. There's a lot of people that follow the Ornish diet. I bring it up because a lot of it has been disproved. This is all the supplements that the prostate cancer patients were taking. Lycopenes, vitamin E, selenium, all have been found not to be very helpful, although may contribute to a better diet. The only thing that they have found, and there's a study out of UCLA, that pomegranate juice daily, 8 ounces, has been shown to reduce or increase time to progression or failure of your prostate cancer. But it is not very easy to drink a glass of pomegranate juice a day because it's very tart, and most people, after they drink it a couple of times, they decide that it's not for them. Anyway, but it has been shown to do that, and we're not exactly sure why, but it's something with the antioxidants, we think. There are a lot of herbal agents, and I have my book of Japanese and Chinese herbs that I have to go and look up when people tell me what they're taking, just so that I know it's not toxic or detrimental. But here are a few of the things that maybe are more common herbs that people are aware of and take: ginseng, garlic, green tea, ginkgo biloba, astragalus, and ginger. We use a lot of ginger because it does settle the stomach. It helps with anti-nausea, enhances, but it can enhance blood thinners, so you have to be a little careful with ginger. But it does help with our patients that have nausea after chemotherapy. I might just add that taking something that was just brought up at one of the meetings, more and more when I go to these cancer meetings, I just came back from the American Society of Clinical Oncology meeting in Chicago that they have every year, that they are bringing more and more survivorship programs through. There's a track just for survivorship and about a lot of these adjunctive therapies, integrative medicine. And so more and more they're recognizing that this is a topic of interest, and your patient and our patients are interested in this as well. So I did go to one of those. I learned a couple of things. One, that omega-3s in higher doses may actually help with the joint aches that they see with aromatase inhibitors for breast cancer, and helps with that. So I've been recently telling my patients that they can try that and see, because it'll help your heart too. And another thing that women complain about, after treatment, is that they have vaginal dryness, and one of the things that they use as a natural lubricant is pomegranate oil, if you can find it. It's supposed to be one of the better things and less messy, etc. But little hints like that, bring back little pearls for my patients to benefit from as well. Everybody talks about aspirin and how it may or may not prevent cancer. 1 year it will say yes, it helps prevent colon cancer. The next year, no. I think at the current time, the strategy is that if you don't have a contraindication to taking aspirin, then then it's okay to take it. And it may help or it may not, but we don't know for sure. How's that? There is some indication for reduction in incidence in particularly some breast and colon cancers, I think. They think it decreases inflammation, and that's why they also were using Celebrex, which is an anti-inflammatory, to help prevent patients with polyps. And again, the bottom line, decision for aspirin use to be made with your doctor based on your medical history and your risk for bleeding or ulcers or whatever else you could get. Exercise, well, we're going to get an exercise demonstration in a little while, but it improves pain through increasing natural endorphins, and it decreases your stress. And we think that exercise keeps you lean. The more lean you are, the less body fat. You have a lower incidence of certain cancers like colon, breast, and prostate. The current recommendation for sleep, 7 to 8 hours of sleep per night. Too little or too much may increase your daily fatigue. Most people can't sleep as much, and they have all these Fitbits and things to monitor how much really good sleep you're getting. So that these things are available if you are technically savvy enough to hook it up with your computer or iPhone or whatever. We use a lot of acupuncture. We work with a lot of acupuncturists in the community. I think that acupuncture works very well for certain things. I have patients that utilize acupuncture for nausea and vomiting. It works very well. They put needles in your ears on the days of therapy, and they're small needles, and you just rub the needle every so often, and it helps. I've had it work when it hasn't worked with anything else work for the patient. I've tried all kinds of medicines, and it doesn't work, and acupuncture has worked. It may actually help elevate certain people's white count. I've had people use it to help keep them healthy if their white counts are low from chemotherapy, help with pain, help with anxiety, help with a lot of different things. So I think acupuncture is definitely a therapy to be thought about if you have problems and you don't have to take medication. And it's also helpful for some people with weight loss and smoking cessation. We don't have somebody that does body work, but I think human touch is very therapeutic. I think that a doctor that doesn't touch their patients is doing them a disservice. To examine someone or to hold their hand or to give them a hug, there's a positive transfer of energy. So any type of body work, including a standard massage, shiatsu, Bowen therapy, which is healing touch, or Reiki, I think is beneficial. I don't know, I'm just sensitive to these things, and I used to have a nurse that did Bowen therapy, and I used to fall asleep in the chair all the time when she was doing this. But it was very restful, and I felt like I had slept a good night's sleep after being particularly grouchy in the morning or something. Reflexology, the study of pressure points in the foot. My dad was a big reflexology nut, but I think that your feet are very important. So if you can take care of your feet, that it may help the rest of your body too. I think aromatherapy is particularly effective with women. Women are much more sensitive to smells, odors, pheromones, a variety of different things, and use of things for relaxation, for nausea. A lot of people use peppermint when they're on a ship to make sure they don't get seasick. A variety of these things actually help because they do stimulate different parts of your brain. So the smell goes into your olfactory bulb, and that's where it's very close to the brain. This is a real big topic now because we even have this on Oncology TV at the Torrance Memorial. We have something that Miriam actually spearheaded, I believe. And where they actually have a variety of mind-body things on the television to help you relax. And this includes, visual imagery and listening to tape as well, taped messages, as well as you listening to peaceful sounds and a variety of things. And who can rest in the hospital? It's really, I think, helpful. Mindfulness is something that is being studied a little bit more. It's it's a type of meditation. And we had, I think, a speaker from Torrance Memorial, was Dr. Grab, that is very much into mindfulness, and it's just recognizing what's going on in your body and just recognizing for what it is and not judging it. So it helps you to deal with a variety of different pressures and anxieties that go on through the day. And then you'll get, I'm just going to just talk about yoga, just to mention that we're going to get a demonstration on it. And there's a whole bunch of different types of yoga, and I don't understand it, but I've tried it myself, and I just laugh when I'm trying to do it. Because I can't do anything that they want to do, but we just try, These are things that are available at a lot of the places for free, like at the Cancer Support Community, Tai Chi and Qigong. Biofeedback is something that we have used in the past. We were sending people up to UCLA, and they had that to help them use their mind to relax. And then, of course, what I had talked about, visual guided imagery and things. So I'm going to this was a quick overview. I'm not an expert on this by any means, but I think that I'm sensitive to what our patients are wanting to do, and providing it's not counterintuitive or counterproductive to what they're going through in terms of their therapy, I think it's very helpful. And if it helps one person, it may not help everyone, but there are a variety of different modalities that are available, and you have to just find the one that you think will work for you. And with that, I'm going to have, I don't know if anybody has any questions on anything that I've said, or...
So there's some microphones that'll be coming around. So just put your hand up and we'll bring the mic over to you and you can ask Dr. Nish.
And if there are, there is one. Or a couple.
Hi, my name is Frank, and I have pancreatic cancer right now.
Mm-hmm.
I was just going to ask, you talked about other things like yoga, exercise, diet, that kind of stuff. Are you going to ever talk about cannabis for helping with cancer?
I am not an expert on cannabis, I'll have to say. Somebody wanted me to do a talk on cannabis for Torrance Memorial, but I'm not the expert. The cannabis oil is different from the THC, which is the part that gives you a buzz, but it's also that THC is the part that actually is more anti-nausea and also more appetite stimulation. And it's the THC part that particularly our seniors or people who haven't experienced the use of cannabis in the past. They don't care for that because it makes you. But I think that it is something that I didn't mention, but it is something that I think is very helpful. And in some patients, I've had unbelievable results in terms of nausea control, appetite stimulation, anxiety control, pain, so sleep. Yes, it's not for everybody. But I think that I'm definitely a proponent for use, but controlled use of cannabis oil and the other products. But I usually refer them. There's a couple of doctors that I refer to. One is Dr. Bonnie Goldstein up in Hawthorne. Another one is Richard in Long Beach. But there are several that are, and I like when they always ask for records from our office to make sure it's legitimate, which makes me feel better too. Okay.
Thank you. I'm wondering what aromatherapy increases cognitive behavior?
That's something that improves sharpness, mental sharpness. Are usually the citrus.
Citrus.
So orange or lemon or grapefruit is what we usually say.
Okay.
because that makes you more alert, awake.
Do you know how long you have to sniff it?
I don't know. I guess you know what I have, and I put it in the office sometimes. Is a nebulizer. And
Okay.
and I don't like. You can use you use essential oils. It's important to use the actual oil, not just a scent that's lemon scented or whatever. It has to be actual. And they sell it at the Torrance Health Links store, which sells a lot of things. Here I'm doing all these commercials for them, but they are available there, and it's high grade essential oils that you can use. Use a nebulizer. They sell nebulizers too, and I don't know the timing on that. I'm not an aromatherapy expert. I have gone through a couple of classes for aromatherapy, but yeah, it's more, and there are different ways of doing it. You can use a nebulizer, or you can put the oil directly on your temples or in your wrists, or use it to smell on a handkerchief and things like that.
Thank you.
There's one up front here, Susan.
Oh, thanks. What dose of omega-3 do you recommend for joint pain with Arimidex?
That I knew you were going to ask me that. And I'm going to say I'm not sure what there's a on the package it usually says what is recommended, and I usually follow whatever the directions are. But yeah, I think a lot of the and then you can increase it slowly and just watch too. Yeah.
What are your thoughts on the ketogenic diet?
I'm not I'm not the expert. You might want to talk to our dietitian.
Oh, yeah, that'd be a good one for
Yeah, but yeah, I think that there are pluses. I always think that anything that when you go into a keto diet, it means you're partially starving yourself. So you're forming ketones, or you're going into like a ketoacidosis. It's not always safe for everybody, but I'm not a person that is a starvation kind of person. So but I'm not the expert on that. So you might want to ask our dietitian. Hey, yes, in the front.
If there's a real problem with sleeping, what do you think about lorazepam, 0.5 milligram sleeping pills? Is that bad news?
It depends. Certain people tolerate it, some people don't. You can try a variety of natural things. People try melatonin. I think just taking things like that are high in tryptophan, so like milk or turkey. That's why you feel sleepy after you have your Thanksgiving meal, and you sleep on the couch watching the game. Yeah, no, you can try that, especially if you're needing to gain weight. I tell my patients, yeah, eat before you go to bed. That's the bad thing, but you need to do it. Other things like aromatherapy, particularly, like I said, with women, but lavender, I think, either sprays on the pillow. Again, using essential oils, I think it relaxes you. I think they have lavender pillows, sachets, a variety of things. I did it for my daughter. She used to have nightmares, and I bought her I don't know the power of suggestion, but I bought her a lavender stuffed sheep. That she loved sheep, so I bought her the sheep. And I had her sleep with it on her chest, and then she never had him after that. Night terrors she used to have. She used to wake me up. I never got any sleep because she'd wake up in horrible dreams. After that, I got sleep too, so it worked. Yes.
What I have found, and it may just be me, is Epsom salts bath makes me really sleepy.
Well, taking a warm shower actually tends to relax you.
What about Epsom salts would do that?
I'm going to say I don't know.
Oh, okay.
I think it's more the warmth.
So I know we have a question here and then one up front over here. So let's go ahead here.
Have you ever used Boswellia serrata for pain? It's in quite a few joint formulas. I know it works for me, and I also take it alone. Boswellia serrata, it's also known, it's frankincense.
Yes, a couple of my patients have brought that up, and as long as it's not, I don't think that there's a problem. Again, whatever works for some people, whether it be Aspirin cream or, icy hot or salompas or cannabis or omega-3s, or depending on what the cause of that. Yeah.
A lot of the things you mentioned up there are all related to what I call stress relief, getting people to relax in one way or the other, using one of the techniques that you used. I also am aware that the medical profession, doctors like yourself, very rarely ever talk to hypnotists, and they don't really talk to you guys either, but they are very good at helping one control one's thoughts and helping you forget about your fears. They're very good at helping you forget your fears, which is another way of reducing stress. So has anybody done any studies to look at hypnosis in terms of reducing the stress and benefiting cancer patients?
I'm not familiar with it, but I know that it's been effective for smoke cessation. And to me, anytime somebody wants to control your mind, it's kind of scary. But
well, my personal experience is I had a 95-year-old mother, and she fell, and she was deathly afraid of even sitting up on the side of her bed. And the physical therapist said, physically, she's strong. It's all up here in her mind that she was afraid that she would fall again. So I said, I don't have anything to lose, so I called in a hypnotist. He talked to her for an hour and a half, and she got up in the middle of the night and went to the bathroom by herself.
Well, that's very good. Well,
I didn't believe in it before, but I do now.
But whatever, stress is a bad thing. And unfortunately, our society, who doesn't have stress? And that's a bad thing because it does, I think, impact on our immune system and our ability to heal our bodies. And if we can just reduce our stress, easier said than done, then it is. I like to go for a good massage. I like a good body scrub at the Korean spa. I like a good tennis game, or I used to run until my knees got bad. But I like to hike, so I do a lot of things to try and, reduce my stress, because especially with physician burnout being so high, it is stressful, especially when you're dealing with, people don't realize we're human too, and every loss we have in terms of patient that, dies with us is like a failure, we think. And so it's stressful, but it's part of the job. Thank you.
All right, thank you. Okay, so I did want to mention too that at Cancer Support Community, we do have this month, if you check out our calendar, a hypnotist who's going to be teaching self-hypnosis. There's 2 different classes this month, so that may be of interest. His name's Duncan Tooley, but that's in our calendar, our August-September calendar. So let's just give Dr. Nishimoto one more round of applause. We really appreciate him coming, giving that informational outline. Our next speaker tonight is Michael Norder. He got his start in yoga after a car accident that left him with severe back and knee injuries and in constant pain. So out of desperation, he started yoga. And then after 3 years of practice, he was mobile again, and the back injury was completely healed. And that's what sold him on yoga. Michael's a true Renaissance man. He's a chemical and safety engineer, a clinical and social psychologist, a public speaker, a writer, a humorist, and he tries to be an artist. He's also a yoga teacher. His style is eclectic hatha yoga with influences of flow and Iyengar yoga. He specializes, or his specialties are restorative yoga and gentle yoga, pranayama, breath control yoga, and meditation. And he's practiced yoga for more than 25 years. This includes vinyasa style with Sherry Matson, and he trained as a yoga teacher by Leanne Carey, and as a restorative teacher, a yoga teacher by Jillian Pransky. He also studied with Yogi Max Strom, and his training includes more than 15 yoga retreats, more than 20 yoga intensive courses, and extensive training in various meditation techniques. He's taught beginning and intermediate level yoga at both the Benjamin Center, which is Cancer Support Community LA, for 8 years, and he's been teaching beginning and restorative yoga at Cancer Support Community in Redondo Beach for the last 5 years. He strongly believes that everyone can do yoga. So please help me welcome Michael Norder.
So before we go any farther, I see everybody kind of doing this. So whether you're sitting down or whether you want to stand up if you want to. We're going to do something really simple. Put your hands together like this. Take an inhale and sweep your arms up. Lift your chest. Exhale back to your heart. Inhale. Exhale. Inhale. And exhale. Close your eyes. Feel any differences. And then just relax, sitting back down or standing, whatever you prefer. I just wanted you guys to wake up a little bit, that's all.
Are you saying I put them to sleep?
No. They were just kind of getting settled in, and I wanted them to be up. Okay, how about this? Here we go. Hey. I love this. I'm always doing that which I cannot do in order to learn how to do it. There's this thing in our society that says, if you're not perfect at it, don't do it. Well, how do you get to be good? You try and you try and you try. When I first started, I couldn't do anything. And I do mean anything. That was Pablo Picasso. I hope I'm not offending anybody here. Now, on some of your handouts there, I'm listed as a yoga instructor, and I told them, no, I'm not a yoga instructor, I'm a yoga teacher. So it would be like calling Dr. Nishimoto a first aider. I am quite sure he can do pretty good first aid, but he's a little more than that. And his training is much more than that. The same thing with the yoga teacher. We're not paid anymore, and our society doesn't really recognize that, because in our society, yoga teacher, yoga instructor, what the heck, it's just exercise. Well, yoga is much, much, much more than exercise. And that's why some of us became so enamored of it that we became teachers, because it takes 10 years of study or more, and I don't even think I'm halfway there yet, but I've been teaching for quite a while. But when I go to my teachers, they know so much more, and they're so much better, and they know so, oh my God. So that's the difference, is it's not about the physical, it's about the mental. But in the beginning, we all know that you're going to be out there doing, this, and you're not going to be very comfortable doing it. And I'm going to say, push here, back here, do that. Do you feel this? Do you feel that? Because we're trying to develop the mental aspect. Prepare to get shocked. You know what yoga really is? It's meditation. You're meditating while you're moving. You're feeling the body. And that takes a while. Everybody understands that. So the main thing in yoga is practice, 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 practice. We don't call it exercise, we call it practice. And sometimes it takes a leap of faith because you don't feel like you can do it. And there's lots and lots of poses you can't do. And everybody understands that. So what a yoga teacher does is they modify the poses and they give you alternatives. Okay? And this is important. 20 years from now, you're going to be disappointed by the things you didn't do, not the things you did. And I can assure you that is absolutely true. It's another way of looking at it. Let go or you're going to be dragged along. Life is going to pull you. So why do I teach? For some reason, it's about giving back. And it's about, there's a lot of satisfaction to it. And that's why, yes, I am a volunteer teacher, but it's still very rewarding. So how does it heal you? Well, breath and movement and awareness and rest. Breath is life. It's what we call pranayama. It means energy coming in, prana. That's energy coming in. If you're not breathing, you're not living. You can go without food for how long?
30 days.
30 days. How long without water?
3 days.
3 days. How long without breathing?
3 minutes.
Yeah, 3 to 5 minutes, you're gone. But you find out as you get older, you become more sedentary and your breathing is much more shallow and you're doing this. You don't see that, but that's what you're doing. And so you're not really breathing. So your heart has to beat really fast to try to get anything out of your lungs that it can. So breathing is really important, and we want you to expand and open up, and that also takes years because you've taken years to do this. Your body is made to move. When you don't move your body, it starts falling apart and it starts decaying. It really does. And you can really see the difference between people who exercise a lot, because no one ever gets my age right when I say, guess my age. They're always off by 20 years. And it's because I use my body. But remember, I was really in bad shape. I was smashed up. I gained a huge amount of weight. I couldn't walk more than 30 steps before I needed a rest. And I knew I needed more help. And somebody said yoga. I couldn't do it. But I found a type of yoga that I could do. And there's so many types of yogas. Oh my God. We'll talk a little bit about that. The more you use it, the more you become aware of its needs, because your yoga teacher will always be saying, can you feel this? What does this feel like? Can you feel your breath? Are you pushing here? Are you pulling there? And you may not even be able to sense it. But after a while, you'll start to pick these things up. Remember Dr. Nishimoto said about mindfulness? If anybody's rich, anybody rich? Because I really like to go to that training. I've taken the training myself 3 times, but I'd like to become a teacher, but it's just too expensive for me. But it is here in town. So I think it's like $12,000 or something like that. But then if I get certified, then I can teach all of you guys for free. So if you know anybody who's rich. The more you do yoga, the more mindful you become. And I first noticed this because in my other job, which I'm unemployed in, as a safety engineer, I'm always in the situation where I'm having to tell really powerful people the word no. You can't do that. That's breaking the law. You're endangering the employees. You're putting the company in danger. And they don't react well to that. They usually go insane with rage. And they're yelling in your face, just screaming at you. And this is the person who could fire you instantly and no one would ever say anything. I noticed what yoga had been doing for me because I didn't have any reaction. I would just sit there and listen to them. And I might say, oh, you have a good point there. And that actually calms them down. I actually didn't feel threatened by them doing that. So can you even do yoga? How many people here are kind of suspicious that you may not be able to do yoga? How about that one? Now, I'm a teacher, and I've been studying, the people I study with or practice with, they're all yoga teachers, and they're all better than me. And we've been practicing together for more than 20 years. And I can't do that one yet. When you're flipping through the channels of TV, did you ever come across NASCAR? Pretty intense. Yeah, and they're just like, did you ever watch those just for a moment or two? Just watch them? You know, they're going, how fast? It's more than 200 miles an hour. So it's not quite 300, right? 200 something, yeah. And they're like this far from each other and this far from each other's bumpers, and yet they rarely have an accident. Is there anybody here who can drive that well? None of you? Well, then how dare you drive your car if you're not the best in the world? See, the yoga profession it's an industry. It's like anything else. It's been commercialized. And so they put up people like this saying, look what we can teach you to do if you're already there. A lot of the people like you see like this, they're actually ballerinas. They've been gymnasts. So they had a big head start on everybody. So think about it as just like NASCAR. You can drive your car fine, right? Just because you can't win at NASCAR doesn't mean you can't drive your car. Just because you can't do that doesn't mean you can't do yoga. Now, I love this picture. Being as I'm a yogi and a yoga teacher, this is from the front cover of Yoga Journal Singapore edition. Yes, we have journals. It's all very scientific. And I really like that because it took me 20 years to do that comfortably. And you notice she's dirty. And her foot is dirty. Now, if this was the American edition, they'd airbrush all that out. Is yoga a religion? I sometimes get this question. I'm really surprised by this, but some people are told it's a religion. You can't go in there. You're going to worship Satan or something. I don't know what it is. So here's the two things you'll hear most of all in my class. Drink more water, get more sleep. So I say these things religiously. Just about every class I say these things. You'll hear these words. Om, Shanti, Namaste. What does Om mean? It actually has no meaning. It's supposedly the sound you hear in very deep meditation when you're really deep. You've been there for hours and hours. Supposedly that's the sound you hear, the sound of the universe. So I tell my students it's the auditory equivalent of the microwave radiation background noise left over from the Big Bang. I don't know whose religion that violates, but okay. Shanti means peace. I guess most religions are against peace. And Namaste, there's different spellings of it, means the sacred in me recognizes the sacred in you. And you use it just like aloha. It's like hello and goodbye. Here's another one. Lokaha samastaha suki no bhavantu. I like to chant that sometimes at the end of classes. It's horrible to most religions. It means may all beings everywhere be happy and free from suffering. I like it because it's about 8,000 years old. And the fact that those people back then thought about people on other planets, because it actually means for the whole universe. So let go of the past, and the past is going to let go of you. So I'm going to try a little exercise here. We already did this one. So instead, I want you just to breathe into your belly. Just stay with that for a moment. And then if you want to, you can put your hand on the side of your chest and your ribs and breathe into your chest. Okay. Now we're going to combine that. You're going to breathe into the belly and then the chest. How does that feel? Is that okay? Is there anybody who couldn't do that? I tricked you. That's yoga. So you can all do yoga. The hardest part of yoga is getting there, rolling out your mat. If you're breathing consciously, you're doing yoga. I don't know who this guy is. Is there anybody who can't do that? How about that? Notice these things here. Notice all that stuff? Those are called props. We use them in yoga in a particular kind that I've had a lot of experience at. I teach Monday nights at the Yoga Cancer Support Center it's on the pier, Redondo Beach. It's called restorative yoga, and it's exactly what it sounds like. It's about restoring your health, and anybody can do it. We can modify your poses. Like certain women, they can't be on a particular side after breast cancer or after surgery. We have a modification for that. We can modify for just about anything or substitute poses. And just about everybody can do restorative yoga. So never really worry about that you can't do yoga. You can do it. So don't wait. Life goes on faster than you think. It really does. It's okay to be scared. It's okay to be uncomfortable. You're going to succeed in spite of how you feel. Gratitude helps you see what's there instead of what isn't there. We all experience loss. Buddha asked, "What have you gained from meditation?" He replied, "Nothing. However, let me tell you what I have lost. Anger, anxiety, depression, insecurity, fear of old age, and death." So some of the most important things in yoga are breathing. Practice, 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 practice. All things are coming with practice. Savasana, or Shavasana. Every yoga class ends with this. It's resting. At first, when you do it, your mind is going to be wheeling and wheeling around. All those anxieties, all those worries, all those plans, all those fantasies, all those criticisms, they're just going to be overwhelming you. The reason why we do this, it's called the hardest of all poses because it's a mental pose. We're trying to get you to slow down and stop. And it takes years. I didn't believe I would ever do it because my mind just like this. But eventually I noticed one day I wasn't thinking. I wasn't producing thoughts. Your mind produces thoughts like your mouth produces saliva. It just does it. So when I first started meditating, I thought I would never do it. I tried to measure it with how many breaths I could do, and I couldn't get more than half a breath before the thoughts invaded and took over my mind again. But eventually you'll learn to just watch the thoughts go by, just like clouds. And you'll realize you can go 2 breaths, 5, 10, 20. You realize you can do it. And you'll feel so much more comfortable, and so much more relaxed. And you can go into that relaxation like that, just bang. But you won't be able to do that in your first year or second year, maybe not even 5 years. But eventually you'll be able to do it. Courage is important. I'll ask people to do things that they're not comfortable doing. You know, that kind of stuff. Balance is important. Strength is important. But flexibility, way down the list. Way down the list. It comes on its own. Don't worry about it. So breathe in, exhale. Another thing we do is yoga nidra. Means yogic sleep. We try to put your body to sleep and keep your mind awake. And the general rule of thumb is if you're under in yoga nidra for about 20 minutes, that's worth 40 minutes of sleep. And we teach you about things, about different ways to sleep too. Like, for example, this is my favorite one. Somebody told me the other day, one of my students said, "I tried your trick and it really works." Sorry about that. Doing this makes you sleep. It doesn't have to be a chair. Could be a pillow. Could be the side of your bed or the side of a couch. That pose tells your body something. I don't know what, but it seems to tell it it's okay to relax and to sleep. And yoga nidra is a systematic method of relaxing the body. That's what that is. When you have this stillness, all kinds of wonderful things start happening to you. But it's like any good skill, it takes a while to learn. So happiness is a choice, not a result. You can't be made to be happy. You have to choose to be happy. It can only come from you. So no matter how hard the past, you can always begin again. I like this kind of stuff. I always put something like this in my class. Let go of what's gone, be grateful for what remains, and look forward to what's coming. You can't go back and change the beginning. We can't change the past. We can only be where we're at now. And I like this. These are two geniuses here. Life is like riding a bicycle. You have to keep moving. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But you have to keep moving forward. Dr. Martin Luther King. See the steps? Can't see where you're going, though. So that's what faith is, when you can't see the top. So you can stand up for this, or you can sit. So I want you to sit forward on your chair. This. This. Bring your hands to your sides. And then with an inhale, raise up your shoulders. Exhale, drop them. Inhale up. Exhale, drop. One more up. Bring up both arms. That was great, watching everybody's arms go up. That was great. And then you're going to inhale, stretch with one arm. Exhale, come back down. Inhale up, the other arm. Back down. Now we're going to do the same thing again, except don't worry so much about your shoulder. Try to stretch here in your rib cage. Bring your hands down. Take your fingers together like that. Turn them out, push them away from you. Bring them up. Take an inhale. Exhale. Bring them in front of you. Pull your stomach in. Push your back backwards. Inhale, come up. Exhale down. Inhale. Exhale. Take those hands out, shake them out a little bit. Shake your arms out. Put your hands right above your knees. Try to keep your head kind of like attached to your chest. What people do when we do this, I see their neck and their head moving because it's so hard to move their chest and their back. I want you to inhale and lift your chest, but not your head. Exhale, round your back, pull on your stomach. Now look down. Inhale, lift the chest. Exhale, round. Inhale. Exhale. Shake it out again. Bring one arm up and the other one down. Push the hands in opposite directions. Then switch. Go back to the first side. Take an inhale, look up underneath your arm. As you exhale, look back down at the floor. Switch hands. Inhale, look up underneath the arm. Exhale, look back down at the floor. Down, shake it out a bit. Take one knee, cross it over the next knee. And then put your opposite hand on the outside of that knee. Take the other hand that's free, grab a hold of the chair. Take an inhale. Try to raise your spine towards the ceiling. Exhale and turn towards that knee. Back to the center. Bring that knee down. Cross the other knee on top. Same thing, keep a hold of it with one hand. Take your other hand, grab the chair behind you. Take an inhale, lift up. Exhale, turn towards the knee. Inhale, come back down. I don't know if everybody can do this, but we'll try. I want you to stand up. Grab the back of your chair, or somebody else's chair. And you're going to try to walk back so that your body is horizontal to the floor. Put a little bit of bend in your knees. And then instead of straightening your legs, try to push your hips backwards. That will straighten your knees. And then bend your knees again. Inhale, push the hips backwards. Exhale. Bending the knees, and then exhale, do it one more time. And walk towards that chair. Turn it around. Put your hands on the chair. Walk your feet back just a little bit. And then you're going to bring your torso and your head towards the chair. It's okay to bend your knees, or you bend your elbows. And then push backwards. Back up. One more time. Bring your head down. Push back up. I'm going to try something else. From sitting, so sit back in your chair again. Yes, just a little bit of movement. And then inhale, see if you can raise up one leg. And then exhale, bring it back down. And then the other leg, inhale. Exhale, back down. Inhale. Exhale. Inhale. And exhale. Oh, looks like you're all doing that pretty good. So, come up to standing one last time. You can have your chair either way. So keeping a hold of your chair, you're going to raise the leg again, but backwards. Inhale, lift it up. Exhale, put it back down. Inhale, lift it up. Exhale, back down. You don't have to lift it up towards the sky. You don't have to do this. You got to wait till you're in my class before you do that. That's good enough. And sit back down. I'm going to do a little more breathing now. We're going to inhale for a count of 4 and exhale for a count of 4. When I get up to the top, I want you to stop. Notice that everything is motionless. When you're completely inhaled, everything is motionless just for a moment. And then when you exhale, when you're completely empty, it's motionless for a moment. So take an inhale, 2, 3, 4, hold, exhale, 2, 3, 4, hold. Inhale, 2, 3, 4, hold, exhale, 2, 3, 4, hold. Inhale, 2, 3, 4, hold, exhale, 2, 3, 4. Return to your normal breathing. Close your eyes. Try to feel where the weight in your body is. Under your thighs, under your sits bones, under your feet, under your hands. Try to imagine that your body is like a puppet. Everything's connected together by strings so that every joint just falls loose and open. In your mind's eye, visualize a golden light. Beautiful, warm, welcoming. And with each breath, imagine you're breathing that golden light into your body. And if there's parts of your body that need more healing or more attention, breathe more of that golden light into those parts. And then just relax and let yourself just be alive for a moment or two. And then blink open your eyes. Namaste. Welcome.
Thank you, Michael, so much for that. You know, oftentimes we have someone who may come and speak to us about yoga, but it's rare that we get to have the actual opportunity to try a few things out. So I'm glad you could participate in that. Tonight, we really want to reinforce the importance of physical activity and exercise for cancer survivors. There's a lot of resources here in our own community that can get you to at least try it out and hopefully stay active. And Beach Cities Health District has their Center for Health and Fitness. How many of you guys have ever tried out Beach Cities Health District's Center for Health and Fitness? Just by a show of hands. So we have a few here. Today in the audience we have Annalise Tripp, and she's waving her hand over here. She's a trainer over at Beach Cities Health District with the Cancer Exercise Fitness certification. So she is well qualified to help with any of that. She does personal training, and there's fitness classes available there. Cancer Support Community partners with Beach Cities Health District and offers an 8-week class called Return to Wellness, which is completely free. But I think they'd be happy to show you what they have available in their gym, and you can sign up for classes there. I know they have a great Silver Sneakers program too, right? So check that out if you're interested. Cancer Support Community, as Michael said, he teaches 2 of our yoga classes. We have some form of yoga every single day. Everything is completely free. I know Michael does restorative yoga on Fridays at 11. And what's your other day?
Mondays at 6.
Mondays at 6 p.m. And then your Friday class is?
Beginning at 11.
Is beginning. So Mondays and Fridays, but they're in the calendar. Lots of other classes as well. And then Torrance Memorial also has many different programs: Tai Chi, yoga, balance, oncology rehabilitation program. So please make sure you check out the information tables. There's lots of great resources that are free or low cost. And exercise is so important as you move into survivorship. So let's see, we have a couple minutes here. If anyone has any questions for Michael, and just put your hand up because we do have a microphone. So does anyone have a question for Michael? Yeah, it's all that deep. Yeah, all the deep breathing. Okay, well, let's go ahead and give Michael then another. Oh, there is one. Let's,
Well, beginning basic, as the name implies, is very. Oh, sorry. sorry about that, is very beginning. It's gentle, and if there's any problems, we modify poses. And you're not encouraged to be, like super athletic. You're encouraged to pay attention to what's happening with your body, whatever is happening with your body. Restorative is like those pictures we showed you, where you get into a pose where you just relax and breathe. And we use the props, the blankets, the bolsters to get you into those poses, and then you just breathe. And then I'll say 5 minutes later, I'll say, okay, next pose, and we'll put it together for you. And so that's the difference. Good question. Any other questions? Any other questions? Wow, you make me feel like the greatest teacher in the world. I answered all questions.
I just
One
want to
more?
say
Okay.
I'm so happy I discovered you, Mr. Michael Norder, and I just am amazed at how well you're trained. I'll be seeing you soon.
Thank you. I'll be looking forward to it.
That's a nice plug. Okay, let's go ahead and give him just another round of applause and thank him for coming out and demonstrating. Okay, so we do have one final speaker in our Integrative Oncology introduction here, and we have Dianne Staso. She's a registered dietitian who's been working with Beach Cities Health District for the past 5 years. While at Beach Cities, she's counseled a variety of people for weight loss, diabetes, cancer, and other chronic illnesses. She helped develop a 3-month well-being program which combines nutrition along with exercise and stress management. And in addition, she provides lectures and cooking demonstrations on a variety of nutrition-related topics to the community. She's been out to cancer support as well as other senior service centers in the community. She's worked as a clinical dietitian at Little Company of Mary Hospital, which is now Providence, and as an outpatient dietitian at Cedars-Sinai Cardiac Rehab. She has a master's degree in nutrition and exercise physiology from the University of Tennessee. And I think we're going to hear and see some great things from her. So please help me welcome Dianne Staso.
Hi, well, thank you very much. I'm very happy to be here. I'm sort of very relaxed right now. All right, so what I'm going to be talking about today, can everyone hear me? Is reducing our risks. Uh-oh. Oh, there we go. There we go. So I'm going to be talking about reducing our risks of reoccurrence, and then I'm going to do a demonstration of a really quick and easy recipe that we could put together. Now, when it comes to reducing our risks, yeah, oh, you can't hear me? Okay. This? Yeah. Oh, okay, now it's, oh. Whoa. Okay. All right, sorry about that. Okay, so when it comes to reducing our risks, I like to refer to the American Institute of Cancer Research. They come up with 10 recommendations, or cancer prevention recommendation, based on scientific research on how diet, physical activity, and weight affect cancer risk. I think I'm going to put this up a little bit closer here. All right. So these recommendations are updated every 10 years, and the last being in May of 2018. And not only do these recommendations help reduce your risk of cancer, but also reduce our risk of heart disease, diabetes, and high blood pressure. So let's get started. The first cancer recommendation is be a healthy weight. Now, healthy weight is a BMI of 18.5 to 25.9. Does anyone in here, do you know what your BMI are? Raise your hand if you know what your BMI is. Okay. If you don't know what your BMI is, you could go on the computer, you can Google BMI calculator, and you can find it out. But the thing is, I think a lot of us know when we need to lose some weight. And the reason that being in a good, healthy weight is important is because when we're overweight, fat cells produce extra inflammatory chemicals in your body, and fat makes hormones. And this is important especially for I'm going in and out, so I'm going to try to put it right here. This is especially important for hormonal cancers. So, and also we produce more insulin. When we're overweight, we become a little bit more insulin resistant, and we have more insulin running through our body. And when that happens, we get more inflammation in our body. Now that's a big buzzword now, inflammation. When we have low levels of chronic inflammation in our body, through these three things that we talked about, it can cause DNA damage, and that's where cancer begins. Number 2, be physically active. So research shows that exercising 30 minutes a day or 150 minutes per week can lower your risk of recurrence, especially breast cancer. And there are many benefits of exercise. It decreases the hormone levels. It decreases our estrogen levels. It also decreases insulin. It really helps with insulin resistance. When I'm counseling someone with prediabetes or diabetic or has diabetes, first thing I say is you got to exercise. You got to get out and walk. If it's after a meal, go walk for 10 minutes and gradually build up to 30, 45 minutes because it really helps with the insulin resistance, which when that's under control, you're decreasing inflammation. It helps with weight control. It helps us stay in that BMI range. And it improves your quality of life. How many in here are like, oh, I really don't want to go to the gym, or I don't feel like going for a walk, and you go and you come back and you're like, I feel good. It clears your thoughts. It really helps with our quality of life. And just another little boost for beach cities. If you need a place to go or need a place to start for a gym, Beach Cities Center for Health and Fitness is a great place to start. We have wonderful trainers, and we already introduced Annalise Tripp, and she just got certified in her cancer exercise trainer. Okay, number 3, eat whole grains, vegetables, fruits, and beans. I'm going to be spending a lot more time on number 3 after we go through this list here. Number 4, limit fast foods. Many fast foods, processed foods, they're high in calories, they're high in fat, they're high in refined carbohydrates, and they're high in sugar. What happens when we have all these high fat, high calorie, high sugar? Yeah, we get fat, right. It makes us gain weight. So we really want to limit the fast foods. Number 5, limit red meat and processed meat. In 2015, the World Health Organization gave red meat, that includes beef, pork, and lamb, a Group 2A classification, meaning it probably causes colon and rectal cancer. Okay? So the AICR, and I'm just going to use that abbreviation for the American Institute of Cancer Research, recommends no more than 18 ounces of cooked meat per week. Now I have a picture here showing you a 3-ounce piece of meat, and it's equivalent to a deck of cards. How many in here have heard that before? 3 ounces, about a deck of cards. Okay, so you really don't want any more than 6 3-ounce portions per week. Again, in 2015, the World Health Organization gave processed meats a Group 1 classification, meaning it causes cancer. So processed meat includes ham, bacon, sausage, hot dogs, canned meat, beef jerky. Those are all processed meats, and some deli meats. So each 50-gram portion, which is equivalent to a hot dog or 3 strips of bacon, can increase your risk of colon and rectal cancer by 18%. Now that's if you eat that on a daily basis. Okay, number 6, limiting your sugary drinks. When we drink sugary drinks, it increases our insulin levels. And the thing too, when you drink sugary drinks, you're just drinking sugar and there's no fiber around there, so our blood sugar goes up, our insulin levels go up. All right. Now I'm sure you're familiar with colas and sodas, lemonade, iced tea, but what about our friendly Starbucks? Right? Starbucks Mocha Frappuccino, a 16-ounce grande, has 47 grams of sugar. Okay, now you might say, I don't do the mochas, but you might have your green tea latte, which is going to be about 47 grams of sugar also. Or the chai tea latte, about 49 grams. And then while you're at Starbucks, you may say, oh, that blueberry muffin is looking good, and that's another 29 grams of sugar. And then up in the right-hand corner, I have a picture of a Cliff Bar, the nutrition label. And when I put that up there because I want you to get in the habit of really looking at labels. And I tell people the first thing you want to look at is the ingredient list. And ideally, you want the ingredient list to be very small. The fewer the amount of ingredients, the better. But I highlighted the first ingredient, and it says organic brown rice syrup. Whenever you see syrup, that's another name for sugar, even though it says brown rice. And then you want to take a look at what the sugar content is. And this bar has 22 grams of sugar. So now how much sugar should we have? The World Health Organization recommends that no more than 5% of our total daily calories should come from added sugars. And that's about 100 calories or 25 grams of sugar. So let's go back here. There's our grande, 47 grams. We're already way over our amount. The Cliff Bar, 22, we have 3 grams to spare for the rest of the day. And at the Starbucks Blueberry Muffin, we're already over. So my goal here for you is just to really become aware where sugar comes from. Be a label reader. Although as we get into what we should be eating, I'd really like you to eat more whole foods and really, stay away from a lot of the labels. But when you are looking at a label, always look at the serving size. Because a lot of times you might get something that's small, right? A package, like say a small drink. And when you really look at the serving size, it's 2 or maybe 3 servings. And then you always go down and you look at the sugar content. Okay? Now there's other valuable things on the label. If I'm working with somebody with prediabetes or diabetic, we look at the total carbohydrate intake or sodium intake. That's really important too. If you have high blood pressure or congestive heart failure, those are big numbers to look at. Okay, limit alcohol. There's a linear relationship for many cancers with increased alcohol intake and increased cancer, especially breast cancer. The AIRC recommends no more than 1 drink a day for women and 2 drinks for males. A drink is 5 ounces of wine, 12 ounces of beer, or 1.5 ounce of spirits. If you have had breast cancer, I really recommend to try to avoid the alcohol or maybe limit your drink, a 5-ounce glass of wine, to maybe once a week. Number 8, don't rely on supplements. This is important because we want to get our nutrients from food. There's something called the synergistic effect of food. And basically what that means is if we have a food that has, and we're going to be talking about phytochemicals and antioxidants and vitamins and minerals, but say you have a food that has vitamin A in it and you are eating it. Let's take greens, for example. And then you're eating your greens, it has vitamin A, but it also has some folacin in there, it has some fiber in there, it has some lutein and zeaxanthin. These are phytochemicals that are all in those greens. And when we eat them, we get a lot more absorption of that vitamin A with all these other nutrients that are in the greens. Does that make sense? So it's really important that they've done studies before, and I could go on, but how many in here have heard of the DASH diet? Okay, it's called Dietary Approaches to Stop Hypertension. And basically, real quick, because I can get off on a tangent here, they knew that 3 minerals, magnesium, potassium, and calcium, could bring down blood pressure or stabilize blood pressure. But when they gave it to people in pill form, it didn't work. When they gave it to them in food form, it did. Okay, so it's really important that we get our nutrients from our food. Number 9, breastfeed your baby. So anyone in here that is pregnant or has a baby, if you can, it's great to breastfeed because there's research that shows that it'll reduce your risk of breast cancer later on in life, and it's great for the baby because they have lower rates of obesity as they get older. And number 10, after a cancer diagnosis, you basically want to follow these steps again. Okay, I'm going to expand a little bit more on the 3rd recommendation. I'm having trouble with this microphone. Eat whole grains, vegetables, fruits, and beans. We want to eat a variety of healthy foods with an emphasis on whole plant sources. That's my definition of that. So again, healthy foods and emphasize whole. That means foods that are closest to nature's source. We really want to try to avoid the processed foods or minimize the processed foods. Let's start with vegetables and fruits. Notice I put vegetables first because that's what we want to have a lot more of. The benefits of vegetables and fruits. They're low in calories. They're high in volume. They help keep us full. They're naturally rich in fiber and water. Fiber is great for us because it helps keep us regular. And there's two types of fibers. There's insoluble fiber, which we get a lot from our vegetables and our whole grains. That keeps us regular. And there's something called insoluble fiber. That's what we get from beans, from oats, and apples is another one. And they really help with reducing our cholesterol level. They grab onto that bad cholesterol and also help with our blood sugar control. Okay, so fiber is really important. We get a lot of that in fruits and vegetables. We get vitamins, especially vitamins A and C. Vitamins A and C are very important for our immune system. Vitamin A is important for our eye health. Vitamin C, important for collagen synthesis. I talked about these minerals with the DASH diet, potassium, calcium, and magnesium. These are all abundant in fruits and vegetables. And they're full of phytonutrients and antioxidants. These are big buzzwords now. Phytonutrients are plant chemicals that can reduce. Oh, thank you.
Could you just hold that? And we'll
Yeah.
go to this?
Thank you very much. Okay, this is much better. Thank you. Okay, so phytonutrients and antioxidants. Phytonutrients are plant chemicals that can reduce our risk of disease. They're not vitamins and minerals, but they're chemicals in the plant. Antioxidants are, they grab onto free radicals in our body, and basically that we breathe in free radicals every day. But with our diets, with the environment, we take in a lot more free radicals than we need. And foods that are high in antioxidants pair up with this free radical and prevent cell damage. So they're important for our diet. We want to eat a variety of fruits and vegetables. Each one of these colors has something that's beneficial for our health. And we want to eat in season. When you eat in season, you're eating at peak nutrition, peak ripeness, and it tastes better. Okay, vegetables. And this is a busy slide. If you look, okay, first of all, we want to have at least 5 to 6 servings of vegetables a day. A serving size is a cup of raw leafy greens or half a cup raw or cooked vegetables. And you can see that I have a half a cup cooked there and a cup of leafy greens. Now, if you look up in the left corner, I have a bag of organic spinach. That's about, I think it's $2 at Trader Joe's. You can get spinach in any grocery store. But it's nice. It's pre-cut. It's pre-washed. All you have to do is put it on your plate. So it's nice that we have vegetables that we can get that are easy to prepare. All we have to do is open a bag. On the right-hand side, I have some vegetables that are in season. I have zucchini and summer squash. And I put that up there because it's summertime, and those are some that are in season. How many in here have used a spiralizer to spiralize veggies? Okay, good. You could get a spiralizer in Target and Bed Bath & Beyond, but it's fun. You can make noodles with the zucchini. And right here, right below that picture is an example of sauteed zucchini. And below that, we have some sauteed mushrooms. How many in here have tried cauliflower rice? Okay, so that's sort of an example there. And then we're in tomato and cucumber season. We've got a salad there. And then, of course, a spinach salad with berries and strawberries. So I just wanted you to see this because there's many ways we can get vegetables in our diet. And then at the bottom left-hand corner is frozen vegetables. Frozen vegetables are great. They're flash frozen, so they retain all their nutrients, and we can have them in a freezer, and they're quick and easy to use. And some people don't realize this, but they can actually be more nutritious than the produce you buy in the store, because sometimes the produce we get in the store, it might have taken 2 or 3 days to get to the grocery store, and each day you start losing some nutrients. Okay, a very important type of vegetable is cruciferous vegetables. You may be familiar with broccoli. Broccoli is a cruciferous vegetable. The thing with the cruciferous vegetables is they're high in 2 phytonutrients called sulforaphane and indole-3 carbonyl. And you're going to probably be hearing a lot more of those 2 plant chemicals because they can actually stop DNA damage with cancer. So I recommend when I'm working with clients is to try to get at least 1 to 2 servings of a cruciferous vegetable in. In the handouts that I have for you, I have a list of the cruciferous vegetables in a way that you could try to incorporate them into your diet. But again, I just have some pictures here because there's easy ways to do that. We talked about the cauliflower rice at the top. Bok choy is there, and then you got your broccoli. And surprisingly, there's a couple leafy greens that are cruciferous. Baby kale, arugula, and watercress. Those are 3 greens that are cruciferous. And then I have a bag of the shaved Brussels sprouts and also radishes. So these are all cruciferous vegetables. So ideally, if you could get 1 to 2 servings in a day, that would be great. Okay, moving on to fruits. We ideally want to have about 3 to 4 servings of fruits. Now, if you have prediabetes or diabetes, I really recommend that you try to space them out during the day. But fruits are really important because, again, they have fiber, they have vitamins and minerals. So, again, some more pictures to try to, stimulate your mind of all the different fruits and vegetables we have. So a serving would be a small piece of fruit. You could think of a baseball, because when you go in the grocery store, apples are huge right now. A lot of the oranges are huge. So think about the size of a baseball. If you're having dried fruit, because it's concentrated, it's about 2 tablespoons. Now, I have on here, too, I have organic wild blueberries and organic strawberries. Berries are not in season all year long. So if you get them in January, they're going to be expensive, and they're probably not going to taste good. And they probably took about 4 days to get in the grocery store from wherever. But you notice on these, it says organic. And that brings me to the Dirty Dozen. The Dirty Dozen is set by the Environmental Working Group, and these are the 12 produce items that are highest in pesticides. So you really want to buy these organic. You can you can go to the Environmental Working Group website, and they publish it every year. But just to give you an idea, strawberries, spinach, nectarines, apples, grapes, anything basically with a thin skin. Any of your greens you ideally want to buy organic. And then there's the Clean 15. These are ones that you really don't have to get organic because they have a hard skin or that you peel them. Okay, so let's put this all together. So this is a picture of a plate. And this is ideally what your plate should look like at lunch and dinner, and to a certain extent, breakfast. So a good way to get the vegetable servings in is have about half your plate vegetables. So when you are thinking about dinner, you're going to lunch, first thing you could think about, okay, where am I going to get my vegetables, or how am I going to get my vegetables in? And then on the other quarter of your plate is your starches or your whole grains. And a serving size would be 1/2 cup to 1 cup per meal. It all depends on your age, height, and activity level. But some examples would be quinoa, brown or black rice. Has anyone in here tried black rice? Okay, it's also called forbidden rice. It's actually purplish black, but especially if you don't like brown rice, it's a good substitute to try. You could get it at Whole Foods. But it's full of a phytochemical called anthocyanins. It actually has more antioxidants than blueberries because it's really the purple just really is high in antioxidants. Some other examples: oatmeal, barley, bulgur. How many in here have eaten bulgur before? Okay, good. I love that because it comes in a bag. I'm going to show you in the next page. You just heat some water and you put it on, and you got your grain. And I also put starchy vegetables on this side: potato, sweet potato, butternut squash, corn, and peas. They all fall on the starchy part of your plate. And then down at the bottom is your protein. And ideally, you want to have about 3 ounces at your lunch and dinner meal. And ideally, you want to have, I try to encourage people to have fish about 3 times a week. Your fattier fish, like wild salmon, cod, herring. And when you're choosing salmon, I recommend wild salmon because a lot of times we don't know what they're feeding the farm raised. And then you want to try to have a couple plant-based meals where instead of having meat, you want to incorporate either beans or lentils or tofu, okay? So about 1/2 cup to 3/4 cups of beans or lentils would be a serving size for your protein. And then in the middle is your healthy fat. And healthy fat is just a little bit, a teaspoon of olive oil, walnut halves, some avocado, or a tablespoon of seeds like chia seeds, hemp seeds, flaxseed. sesame, pumpkin seeds, we could keep going. But it's important that we have healthy fat, especially with our vegetables, because the fat helps absorb the vitamin, minerals, and the plant chemicals in the vegetables. Okay, these are some items that you should keep in your pantry. Okay, I have oatmeal, and I have an extra virgin olive oil, and I have right below the oats is quinoa and brown rice. These are actually frozen, but I just wanted to show you that there's a lot of grains and a lot of items now that you could buy in the grocery store that are pre-cooked, that if you don't want to make them yourself. And in the corner on the left is the black rice, and then right beside that is the bulgur. But also having a variety of beans in your cupboard. And ideally, you want to get no added salt or low sodium. And right in the middle there is pink salmon. Have any of you seen this by the tuna section? This is a great way to get a little bit of wild salmon in. And the reason why salmon is really important in our diet is it's full of omega-3s. And omega-3s is known to fight inflammation, which is good for us. Okay, I want to touch on the beans and lentils because that's one of the recommended foods in the AIRC's recommendations. So beans and lentils are very nutrient dense. They contain protein, vitamins, minerals, fiber, and lots of antioxidants. And we digest them slowly. As I mentioned a little bit earlier, beans are a soluble fiber. Soluble fiber helps reduce our blood sugar, and they also help with reducing our cholesterol levels. And a high bean intake is associated with a reduction of other cancers, esophageal, stomach, and breast cancer. I tell people, try to get a half a cup to a cup of beans in a day. When you saw that picture of the plate, pretend and we'll go back to that for a second. You could have a salad. So you could have your greens, and then for your protein, maybe you could throw that fish pack on, and then for your starch, you could use a half a cup of beans, okay? So beans are both a protein and a starch, or you could use your beans for your protein, and then you could have a little bit of rice for your starch. Okay, the dairy. Dairy has been controversial because of the fat and hormones, but there's no conclusive evidence that dairy causes cancer, and the AIRC has not put a maximum limit on dairy consumption. So if you choose dairy, you want to choose a low fat, and I recommend organic because it doesn't have any extra added hormones. Now that's extra added hormones. Cows produce hormones, so there's still going to be a little bit of hormones in the organic milk, just as there is in regular milk. But they're not being, a lot of the regular milk is pumped with extra hormones to make the cows be able to produce more milk. So that's an advantage of organic. And it has more antioxidants and vitamins, so whatever the cow's eating, they eat more grass versus corn, which is good, and that increases their omega-3 fatty acid content. And it has more, again, there's no pesticides with what the cows are eating. So you want to consume dairy in moderation, no more than 2 to 3 servings per day. And I have up there men no more than 2 servings per day because there has been some research with men and high consumptions of dairy and prostate cancer, but it's well over 2 servings. We get calcium, we get vitamin D, we get protein, we get a lot of good nutrition from calcium. So a serving would be a cup of low-fat milk, a cup of fat-free or low-fat yogurt or Greek yogurt, and 1.5 ounces of cheese. Now, you can easily have a healthy diet and not have dairy. So if you choose not to have dairy in your diet, there's a lot of milk alternatives you could choose. For example, a cup of soy milk, rice milk, oat milk, almond milk. There's all kinds of milk. There's a milk for everybody. But you just want to make sure that they're calcium and vitamin D fortified. And as far as the soy milk, too, you want to just make sure, I mean, they've done research because soy, has the phytoestrogens in. That you could have up to 2 to 3 servings of full soy products. And when I say full or closest to nature's source, I mean a cup of soy milk, half a cup of tofu, or half a cup of soybeans. I'm not talking about the soy protein isolate that you find in your in a protein bar. Okay, so we have an abundance of soy, and we tend to process a lot in a lot of foods, and that's where we really don't know how that affects our body. Okay, so Lastly, some nutrition enhancers. These are foods that I think if you could try to incorporate into your diet every day, because there's a lot of benefits from these foods. And one of them is turmeric. Turmeric has anti-inflammatory properties, especially when you combine it with black pepper. There's a phytochemical in black pepper called piperine. So whenever you use turmeric, you want to grind some pepper on top to really get more of the absorption of the turmeric. And you know, as far as using turmeric, you can add it to your eggs if you're scrambling eggs. You can add it to tofu, rice, sautéed greens. So there's different ways that you could use the turmeric. Garlic. Garlic is an immune enhancer. So it's great if you can incorporate that every day. But a little tip with the garlic is expose it to air for a few minutes before using it. You get more of the good plant chemicals in there that can help with your immune system. Ginger is another anti-inflammatory, also good for queasy stomachs. The picture that's right beside the ginger is a microplane. Does anyone in here have a microplane at home? Okay, that's one of the tools I love, because you could just cut up a piece of ginger, peel it, and you could just put it into your sautéed greens, or lots of different ways you could use ginger. And also garlic, you can use the microplane for too. And then on the right here I have a cup of green tea. And green tea has something called catechins in. You can get it in green, white, or oolong tea. Especially with this hot weather, I've been making a lot of green iced tea. It's a great way to get a lot of those plant chemicals in. And also cooked Asian mushrooms, shiitake or oyster mushrooms, is something you can incorporate to your diet. So whenever you think about, like, you could saute a little bit of onion, garlic, ginger, and then throw greens in. Or if you're doing a brown rice, you could saute a little bit, again, and adding garlic and ginger and onion. So those are, and add some mushrooms. Some other nutrition enhancers. How many in here have heard of broccoli sprouts? Okay. These broccoli sprouts you could buy in Whole Foods, Sprouts. They're a very concentrated form of sulforaphane and indole-3-carbinol. And I was talking about that. Those are very potent in cruciferous vegetables, especially broccoli. So if you're not a big broccoli fan, you could have a tablespoon of the broccoli sprouts and get as much sulforaphane as 1.5 cups of broccoli. So might be a better choice. And you could use those in wraps, salads, stir fries, and smoothies. Another one is cinnamon. Cinnamon can help with blood sugar control and also can add some flavor. And really get your herbs going. I know I'm thinking a lot of people, when you go in your herb, where you keep or store your herbs, you probably have a couple in there that might have been in there for 10, 12 years. But you know, you could go through them. That would be something that you could do in the next couple weeks, is sort of go through your herbs. But start using them. Use oregano in your salad. Use basil, parsley, which I'm going to use in what I'm going to be demonstrating here. They are like very potent, in small amounts. You get all these good phytochemicals. You get vitamins, and antibacterial, meaning that, like, it helps us resist against bacterial infections. So get the basil and oregano going, and parsley too, and we're going to use that now. And lastly, let food be thy medicine and medicine be thy food. That's from Hippocrates. So I hope you got some information out of that today. Now I'm going to just do a very quick and easy recipe. How many in here like quick and easy? I mean, yeah, okay, I'm very big into that. And this is a lentil salad. You have this in your pack with you. And what I'm going to do is I'm going to put 2 cups of lentils in here. Now, how many in here eat lentils? Oh, great. We got a lot of people eating lentils. Okay, there's several ways that you can get them. I make them. So I just get this at Trader Joe's. It's $1.89, and I make more than I need. And then what I do is I put it in a freezer bag, I put the date on it, and I put it in the freezer. Oh, okay. Thank you. Okay, so like I said, I make a lot, and then I put it in the freezer. I'm going to move up here. Thank you. All right. The other thing that you could do if you really don't want to make lentils, and like I said, lentils are easy to make. It takes, you just do 2 cups water, cup of lentils, You bring it to almost a rapid simmer, and then you let it simmer for 30 to 40 minutes, and you have your lentils done. But if you don't want to do that, you can get them in a can. This is organic lentils, and it's low in sodium. And then this one is from, I'm sure you've probably seen this, this is from Trader Joe's, the lentils. The only thing is when you start putting it in cans and boxes, what goes up? The salt, right. So here, a half a cup of lentils is 0 milligrams. A half a cup of the low sodium, this has about 140, and this has about 250. It will help if you rinse them, so you could get about 40% of the sodium out. But, I mean, I'd love, if this is the way that you're going to eat lentils, I'd like to see you do it. So I'm just going to put the 2 cups of lentils in the bowl. All right. And then I'm going to use a little bit of extra virgin olive oil. Now, I just wanted to mention something about oils. Extra virgin olive oil you should only use on your foods, especially like your vegetables or your pastas or your rice. You shouldn't cook with this. You should cook with what they call high smoke point oils, and that would be like canola oil, avocado oil, sesame oil, or I like to use grapeseed oil at home. But I'm just going to use 1/4 a cup of this. All right, and then I'm just going to use 1/4 a cup of balsamic vinegar. All right, and then I'm going to get my herbs going, and I'm going to put a teaspoon of oregano in. Now, you could easily do this in a cup and then mix it up and stir it, but I tend to just put it all together like this. All right, we got that in there. And then I'm going to just mix it up some. And then this is where you could put in anything you want from here. You have any vegetables left over from the week, you could put them in here. I'm just going to use, in this recipe, I'm going to just use, I have some red pepper. I cut up a red pepper to put in there. Get good vitamin C. And then I'm going to put in some green onion. Easy. And then something for a little change. How many in here use sun-dried tomatoes at all? Okay. This is a good source of a plant chemical I'm sure a lot of you heard of, is lycopene. Okay, lycopene, probably about 5 or 6 years ago, it was very big because it's been known to help reduce your risk of prostate cancer. And they find the benefit is actually, it's more powerful when you cook the tomatoes, so like in tomato sauces, but you still get a lot of good benefit from this. All right, put the sun-dried tomatoes in. And then another herb we just talked about is parsley, high in vitamin C, vitamin A, vitamin K, and good for your breath. And also just a little tip too, if you're ever feeling bloated, parsley is a good thing, like sort of acts like a diuretic. We'll put the parsley in. I'd get in the habit, when you're in the produce aisle, really explore. Just go and, like a lot of us tend to grab maybe a bag of romaine, maybe a bag of spinach, bag of carrots, and we're out of there. Really explore the produce aisle. There's a lot of things that you could try. And one thing I would do is try to get in the habit of buying parsley and just adding it to your salad. And I couldn't resist. I needed a little bit of cruciferous, so I put some broccoli and chopped up some broccoli and put it in. All right. So that's easy. You got lunch or you got dinner there. You could have about a cup of this with a big salad, or you could do a half a cup of this with maybe a half a cup of a grain and a big salad or in other vegetables, and you're on your way. So, all right. So thank you very much. I hope you got some good information out of this.
Thank you so much, Dianne. We're going to go ahead and take some questions that you might have for Dianne regarding diet nutrition. And we do have microphones, so please wait for the mic. So over here first.
Hello, my name is Rose, and my question is, I've heard that nightshade vegetables, like the bell peppers and things, tend to cause inflammation or are not good for arthritis kind of things. There's been suggested that way, so Is that true or not
Well, you know
true?
what? Some people are not allergic to, but are sensitive to a chemical in there called solanine. But so it's not actually true that it is inflammatory for everybody, but some people are sensitive to it. Mm-hmm.
Yeah, regarding salmon, I read on the internet, I looked up Atlantic salmon,
Mhm.
and they said that Atlantic salmon is on the endangered species list, so any fishing for it is illegal. So therefore, all Atlantic salmon is farm raised. Have you heard of that?
And sorry, can you say that again about the Atlantic salmon?
Okay, the Atlantic salmon is a endangered species list.
Oh, endangered species, okay.
Yeah, so any fishing for any wild, it's illegal. So therefore, all the Atlantic salmon is farm raised. Have you heard that?
No, I have not.
Okay, so, well, now on the Pacific salmon, where I go, it's hard to find wild caught salmon. They said they have an alternative called sustainable farm-raised salmon,
Mhm.
which is a little bit better than just standard farm-raised salmon. Have you heard that?
Well, I think the point is with farm raised is there's some farm raised fishes or companies that do that they are feeding the fish algae. They're feeding them things that increase their omega-3s like they would in the wild. But there's some that don't. So I think you just really have to check and see what, you know, what they're feeding the farm raised fish, because that's what's really important. Because sometimes they feed them little fish,
Yeah.
and the little fish have mercury or other chemicals that we don't need for our body. So it's just basically what they're feeding them.
Yeah, I've
Where
seen,
the wild salmon are eating algae, they're eating stuff that are, you know, at the
Wow.
bottom of the ocean.
yeah, I've seen some salmon that are raised like with nets that are in the ocean. Like, sort of, they're like they're like fed. They eat what the wild salmon eat. But other ones are in a pond, you know, where there's teeming in a pond that fed all kinds of bad stuff.
Right. I think you just have to really know the source and
The
see what
source.
they're, yeah,
Okay.
what they're feeding them.
Okay, I think there's a question here that Greg is going to take.
I'm just starting chemotherapy, and I've been told that during chemotherapy I'm supposed to eat foods that are high in vitamin A, C, E, or antioxidants only in moderation. So it sort of is counter to a lot of things that are being said for a healthy diet. So I'm sort of stuck. I'm thinking, what am I supposed to eat if I'm not supposed to eat berries and spinach and all these things that I love? What am I supposed to eat?
Well, I think there's, with what you're saying is I think it's the amount. And what you're, you know, as far as I think that you could still have some blueberries, but it's like you'd still want to just spread out how much you have throughout the day. I know that's sort of like a lot of when you're going through chemotherapy, they don't want you to take supplements that have the antioxidants,
Right,
vitamin
right,
A,
I know
vitamin
that.
C. But as far as the food is concerned, I was under the understanding that it was okay to eat it from the foods. But like you said, not in large amounts.
It just says in moderation.
In moderation. So I would go with you stay with your 3 servings of fruit, and maybe you only have 1 serving of blueberries because that's one that's very high in antioxidants. Maybe 1 serving of greens, and then maybe do some zucchini or do some summer squash. So you would just sort of really alternate. That's where a variety of vegetables really come in. I don't know, did that help? You just want to watch.
Well, yeah, it's just, you look at the list of what are the healthy vegetables are, healthy in antioxidants, and they're all the things that I'm used to eating. And so now it's like, okay, what doesn't have much antioxidant in it?
You
that
would
is
probably just
healthy?
want to get the ones that are a little bit lower. Like I said, the zucchini, the summer squash. A lot of your greens are high in phytochemicals, but I still think you could have like a serving of greens with some tomatoes and cucumbers. It's just, again, it's probably just really watching how much. If I was working with you, I'd really look to see what you're eating right now and how many vegetables you were eating. And then we might, if you're eating in abundance, like you're eating 8, 10 servings, well, maybe we need to cut that down, which is right, the opposite of what I said. So when you're not on chemotherapy, ideally this is how you want to eat. You want to
Right.
push the vegetables going.
Right.
So if you're eating a lot, like are you eating several servings of vegetables and fruits right now?
Yes.
Okay, so what you might want to do is just cut down. If you're having, more than 3 servings of fruit, I'd stay with 3 servings. And remember serving size. I mean, a lot of it, we're in watermelon season now, and it's very hard to stay within 1 cup serving of watermelon, right? Or, berries. Berries is pretty generous. It's about 3/4 of a cup. So it's just really watching how much you're having. So,
But yet, on the other hand, you want to eat healthy and eat enough so you don't lose weight and.
well, right. And so you want to look at the big picture. Like I said, I don't think that means eliminate them. I think it's just that you might want to cut back. And that's where I'd really look and see what you're eating. And I'd make sure that you're getting enough calories. I'd make sure you're getting whole grains and protein and healthy fats. But you still would get some vegetables in there too. So
Okay.
I don't know if that really answers your question. I think the best thing for that would be to sit one-on-one and to really see what you're doing. And then, okay, maybe you can cut back here. Maybe.
Okay.
Okay, and I think she's got a question for you.
My question is about cruciferous vegetables. Everybody praises them, eat lots of cruciferous vegetables. However, if you have a thyroid problem, I've read that you should not have cruciferous vegetables because they inhibit and destroy the thyroid, whatever. So where does that leave people who already have a thyroid problem?
Now that's a perfect issue if you don't have to eliminate cruciferous vegetables with thyroid. It's when you have like 4, 5, 6 servings of cruciferous vegetable, and it's more so when it's raw. So it's like, that's one of those things where you hear that you shouldn't have any, and that's not true. It's you just don't want to have large amounts. And I don't even know, honestly, about the research with that and how much. I don't think they even know what the correct amount is. But it's a high amount of servings of cruciferous. So you could still have 1 or 2 servings. That's another reason why you want to have a variety. Like you're talking about high antioxidant foods. Having a variety of the vegetables. So you might have a serving of cruciferous. You should be totally fine with having 1 to 2 servings of cruciferous in your thyroid. And remember, 1/2 cup is a serving, right? So it's not a lot. So yeah, that's just one of those things where you hear that you shouldn't have. A perfect example, and no one really asked this question, and I didn't touch on it, was vitamin K and Coumadin. I don't know if there's anybody in here on Coumadin, but a lot of times when you're on Coumadin, you'll hear, oh, I can't eat any greens because they have vitamin K in. And the thing is, it's really, it's consistency. So if you haven't eaten any greens and you start eating a bunch of greens, well, then your prothrombin time is going to be all over the place, okay? So you want to make sure that if you decide you want to start eating some greens, that you talk with your doctor and you say, okay, I'm going to have 1 to 2 servings, and you get your prothrombin time adjusted. Or if you already eat greens. So it's just consistency. It's a matter of like eating a whole bunch one day and then you don't another day and you do another day. That's going to really mess up with your prothrombin time. So it's consistency.
Okay, let's take this one last question here. Got a mic coming.
I just want to ask about eggs. You really didn't touch eggs too much on your.
Oh,
okay,
yeah.
eggs versus like maybe even egg whites. I mean, that's that whole thing of like, do we eat them or not?
Okay, so years ago, egg yolks were bad because they raised cholesterol. Now they're finding it's not so much the egg yolks that raises the cholesterol, it's the saturated fat and trans fat. Trans fat we're pretty much getting out of our diet. So you can have up to 7 egg yolks a week and you don't have a raise in your cholesterol. So I encourage people when they do buy eggs to try to buy omega-3 eggs or vegetarian fed. And vegetarian fed that could mean corn fed, or it could mean flaxseed fed. Flaxseed increases your omega-3s. But you want to look, and probably the best bet, your gold standard would buy organic, okay? Because then the feed is usually vegetarian, there's no pesticides, and your omega-3 content goes up. And a lot of times they're really cage-free, meaning that they're out roaming around, they're eating the grass, they're eating the insects. When the hens eat like that, their omega-3 content goes up. Sometimes, because they tend to be more expensive, I'll recommend like Egg Land's Best. Have you heard of that egg? Okay, because they feed the hens flaxseed meal. But going back to your question, that is eggs are a protein source, and yes, you can include it into your diet. I usually tell people like 1 egg a day. You might have 2 eggs for breakfast, but you might 7 eggs a week, 7 egg yolks a week and under. Okay, but it is a good protein source.
Okay, thank you so much, Diane.
Thank you.
And that concludes our evening tonight.